Hi friends, Ebony here. I just wanted to come and talk to you all about heart health because February is Heart Health Awareness Month. And one of the biggest things that is so important to me is making sure that you have the information right out the gate as soon as I learn it. And it's just for me beneficial to make sure that things are explained in a way that makes sense. So one of the things that I want to talk about is hypertension or high blood pressure. And if you missed it, I released a podcast episode on the Thyroid Warrior podcast about this very topic, and you can listen to that on Google Play, Stitcher, Apple Podcasts, any podcasting site or platform that you wish. You can do that. So I want to talk about hypertension, and many of us know it as high blood pressure, and it really does affect about half of the American population in terms of folks that are 65 years of age or older that actually have been diagnosed with it. And honestly, it's not even something that you develop in old age, so to speak. It's something that I am seeing a lot of people recently or in younger years being diagnosed with high blood pressure, and I think that's a problem. And one of the biggest issues surrounding hypertension is it impacts our arteries. It can result in strokes, heart attacks, it can result in kidney disease and kidney failure. All of those things are detrimental to our health, of course. But one of the things that is so critical is just getting that information out there and understanding what can result if you don't, in fact, take care of yourself. And a lot of people talk about it as knowing your numbers, and that is your systolic over diastolic. So your systolic is going to be that higher number and your diastolic is the bottom number. So systolic is say, okay, when blood is coming from the arteries, what's that force or pressure, so to speak? And then your lower number is, okay, once I pumped that blood out, what's my heart behaving like when it's at rest between beats? And that is very, very quick in a lot of cases, because many times we don't even recognize when we're breathing, when our heart is beating. So many amazing things are happening with the body that we just don't pay attention to. But when you think about it, that is, many of us know it as your blood pressure being normal as 120 over 80. When you get into, let's say, the pre-hypertensive stage, that is going to be when you have between 120 and 129 over 80, for example, or you're going to have, recently it used to be 140 over, let's say, 90, for example, in terms of being hypertension, but the range is slightly lower now at 130 over 90 or higher is going to be the hypertension stage. So like 120 over 80 is normal, 130 over 90 and greater is hypertensive. Anything in between that, you're going to be at risk for being pre-hypertensive. So what are the risk factors associated with that? Naturally, age, and then you have to think about your race or your ethnicity. A lot of times African Americans are at a greater risk for heart disease and hypertension. And do you have a family history of it? Or also the other thing that you have to think about is, are you overweight or obese? And when you think about those things, how do you then reduce the risk associated with hypertension? And we know that we have to monitor our blood pressure more regularly. When you go to any grocery store, you have the ability, typically wherever there's a pharmacy, there's usually a blood pressure monitoring machine there. Check it. It takes you less than 5 minutes, but knowing those numbers and actually being able to monitor it is critical. CVS, Walgreens, Duane Reade, whatever pharmacy you go to, CVS, many of them also have a blood pressure monitoring machine in them, or you could pick up one in the pharmacy section as well. So those are definitely areas that you can go to in order to screen your blood pressure outside of the doctor's office. The other thing, naturally, a lot of people say is limiting your salt intake. And a lot of times we do, in fact, need salt, but the recommended amount from the American Heart Association is 1,500 milligrams. But on average, we as Americans tend to get over 3,500 milligrams of sodium per day. And I'm looking over because I'm looking at my protein bars, or just thinking about the things that you consume and having to be very conscious of your food packages, because it may say, when you look at it, 150 milligrams of sodium, but then you don't realize that whatever package or container of the food that you're consuming is actually 2 or 3 servings. So you're actually doubling or tripling that amount. And that's how that number can creep up rather quickly. So those are the types of things that you want to look out for. Is one of the biggest things that I've learned throughout this process of making sure that I keep my blood pressure low is checking for the sodium levels in the foods that I eat, and trying to eat as many whole foods as possible. I'm not talking about the grocery store. I'm talking about eliminating as many processed foods that I possibly can, but also making sure that if I do have something packaged, that I'm looking at the sodium level in it. I'm looking at how many servings is in that particular package. I'm thinking about how much sugar is in this package, because when it comes to processed foods, basically what is being referred to is, okay, I have food, it comes in its natural state. Let's say I'm like, all right, I need something quick, I need to do it. What's happening to that food once it's being processed? Well, the fiber is being taken out of it, the water is being taken out of it. And part of the problem that happens then is sugar, trans fat, and salt is often added to whatever processed or packaged food that you are consuming. Now, I'm not saying that all packaged and processed food is bad. I'm not saying that at all. Not saying that you need to go into your pantry and just dump everything out, because that's also really expensive and it's not realistic for a lot of people, especially depending on your budget. So food is definitely a big way to help in terms of reducing your risk factors for hypertension and heart disease, but also the process of quitting smoking, limiting your alcohol consumption, and diet and exercise. Again, I just talked about diet, but exercise too. And not saying that you have to go out and do CrossFit all of a sudden. You can walk 30 minutes, split it up throughout the day. It doesn't have to be something that's super fancy or something that is difficult. And one of the things that I often hear is, well, it's not really safe for me to walk outside. Okay, no problem. I tell my mother this all the time. Walk around the house, walk up and down the stairs, walk to the basement, walk upstairs, walk to the attic, and come down again. And a lot of times I also stream some of my workouts so that I can stay inside and I don't have to worry about going to different places to exercise. Or again, in the case of my mom, it's just safer for her. So that is an option that we have explored for her in order to improve her numbers and get her blood pressure down. The other thing that we also have worked on is getting her transportation services. So if that's something that she wants to go swimming, okay, let's book a ride. It's $2 each way, $4 round trip. There you go. So I want you to definitely think about how many ways can I go about making sure that I know what my numbers are, and also reducing those things. And a lot of times you can always go to the American Heart Association to find out more information, but the key is going to be knowing your family history and knowing what your numbers are starting out, so that you're equipped with that knowledge, you're equipped with that information and that understanding, so that you are able to really and truly work on improving your numbers. And definitely let me know, especially if you're catching this on the replay, do you have people in your family that are at risk for hypertension or have the hypertension or anything related to heart disease? You can always send me a message in the event that you don't want your comments public, but I really and truly want to have a conversation about this because our health is so important, and it's a lot of information out there. It's a lot of misinformation. It's a lot of conflicting information. So I just want to make sure that I'm bringing you as much as I know and sharing that knowledge with you, so that you can ask me questions and we can go back and forth and have that dialogue, so that when you actually do go to the doctor or you're talking to a nurse or someone that you're seeing, you're better able to ask more informed questions, so that your precious time that you spend at the doctor's office is used for good and getting out, okay, what treatment options do I have? What natural options do I have? Okay, I'm on this medication. How do I come off of it? There are so many more things that you can actually explore during your time with your physician that can just get out the way if you actually start this process now. So let me know in the comments, what questions do you have? And also, what have you learned as a result of going through your health journey, regardless of whether or not it's heart health? But from a thyroid perspective, have you been changing your diet and you're noticing different things? Like, definitely let me know, because I'm really interested in seeing your progress and cheering you on. I would love to hear from you. So with that, let me know if you have questions. If you're catching this on the replay, do me a favor and do #replay so that I know that you watched it, and I will talk to you guys soon.